Hello, and welcome to this week's episode of NHIS in a Week. Here, we bring you happenings and insights of the authority. My name is Bridget Apia. Now the headlines. NHI Kofi unveil report on diabetes and hypertension management. NHI Deputy CEO engages staff in Eastern, Volta and OT regions. NHI Task Force concludes first round of facility accountability drive. The NHI and the Korea Foundation for International Healthcare, (KOFI), have launched a joint report on chronic disease management in Ghana. A national forum was held in Accra to highlight critical insights and drive urgent reforms in hypertension and diabetes care.
Held under the theme Access, Affordability and Outcomes, the forum brought together stakeholders from health, research and policy circles. The event marked the official launch of a joint research report highlighting disparities in treatment experiences between NHIS and non-NHIS members. Speaking on behalf of the NHI Chief Executive, Deputy CEO of Operations, Dr. Sena Nukwesi Jokoto, emphasized the urgent need to prioritize prevention as a strategy to reduce the rising burden of non-communicable diseases.
Ghana, like many nations, is undergoing an epidemiological transition. The burden of diseases has shifted from communicable diseases to non-communicable diseases. At NHIA, we are fully aware that this emerging trend poses a critical threat to the sustainability of our healthcare system. If we do not act with urgency and precision, the growing prevalence of chronic diseases will gradually undermine the substantial progress we have made in expanding health access and equity.
Korea Foundation for International Health Deputy Director, Ms. Shai Eun-kim, stated that 80% of deaths in South Korea are non-communicable diseases related, underscoring the global urgency of addressing such illnesses.
As we all know, Ghana, like many other nations, is facing a growing burden of non-communicable disease. In terms of Korea, the 80% of cause of death is non-communicable disease as well.
Professor Gordon Abeka Nkrumah described hypertension and diabetes as disruptors of productivity, noting that the two conditions now rank among the top 5 disease categories under NHI's claims.
This conference is not simply a research milestone, it is a national imperative. The challenge before us transcends health. It cuts across economic growth, national development, and social equity. Chronic diseases like diabetes and hypertension are no longer silent killers. They are loud and unmistakable, exerting a growing burden on individuals, households, and on our national healthcare system.
Mr. Abbas Suleimana, Director of Research, Policy, Monitoring and Evaluation at NHI, presented key findings. 30.34% of deaths in Ghana are linked to hypertension, while 26.27% are due to diabetes. He stressed the need for stronger public education, especially as 6.7% of respondents did not view the condition as serious. The forum concluded with a strong call for the integration of preventive healthcare into the NHIs to ensure sustainability, better health outcomes, and equity for all Ghanaians.
NHI's Acting Deputy CEO for Finance and Investment, Ms. Anatu Ann Seidu Bugobiri, has toured parts of the Eastern, Volta and OT regions. Her visit aimed to strengthen operational insights and build staff engagement across regional teams.
In a forum held in Koforidua, Ms. Bogobri engaged accountants, managers, and directors from the 3 regions. She emphasized the importance of open dialogue, transparency, and trust in achieving institutional growth.
I firmly believe that the genuine progress begins with open dialogue, such as this one. When we create space for for honest conversations and collaborative thinking. We cultivate a culture of trust, a culture of transparency, and a culture of accountability, all of which are essential for the institution thriving for reform, sustainable growth, and impact. Our division must be impactful because our division is the pivot of the authority. Our division is the bedrock of the authority.
She announced that despite earlier delays in budget approval, third quarter allocations were in advanced stages and will soon be released to support district-level operations. She also confirmed the nationwide rollout of the GiveMates financial system and shared plans to launch a new financial manual to replace the outdated 2008 version. Ms. Bogobri further revealed plans to implement a cashless system aimed at improving revenue collection and addressing underbanking issues in underserved areas.
Additionally, we plan to introduce a cashless system in all district offices. This is a key strategy aimed at addressing the underbanking concerns and improving revenue management.
She called for stronger financial discipline and governance and assured staff of management's commitment to addressing HR and capacity constraints. Eastern Regional Director, Mr. Frank Addo, commended her visionary leadership and praised the inclusive nature of the engagement.
Moving on, the NHIA hosted a vibrant community derby at Dansoman as part of a month-long public education campaign. The event aimed to bring healthcare awareness directly to the residents.
Held at the Royal Hospital in Glefe, the derby attracted large crowds, including members of parliament, traditional leaders, NHIA officials, and community groups. Led by the Provider and Client Relations Unit of the Corporate Affairs Directorate, the derby ran under the theme, Bringing Healthcare Closer to the Public. Acting Deputy Director, Ms. Hamidiya Amadu Yakubu, stated the goal of the derby, which is to enhance stakeholder engagement, to create vibrant platform to open dialogue with NHI's members.
Our goal is simple and yet profound, is to enhance our stakeholder engagement. We want to create a vibrant platform to open dialogue, to listen more intensively, to get experiences and understanding your challenges, and collaborate with you to give you solutions which will strengthen the scheme for our benefit and for the benefit of all Ghanaians.
Member of Parliament, Honorable Joycelyn Kwashi, along with senior NHI officials, including Mr. Oswald Mensah and Mr. Otifrimpong, called for an end to illegal co-payments and encouraged residents to take full advantage of the scheme's benefits. Corporate sponsors Promasidol Ghana, Coca-Cola and Ozone's Chemists supported the event, which was executed in collaboration with the NHI's Ablekuma District Office.
To our next story, the NHI Illegal Payment Task Force has completed a 4-region tour targeting unauthorized charges in health facilities. The Volta region marked the final stop in this crucial national exercise.
Led by Mr. Daniel Frimpong, the task force uncovered widespread co-payments being demanded from NHIS members in violation of scheme rules. Acting Volta Regional Director, Madam Susanna Chopper, reaffirmed the need to protect vulnerable populations from such illegal charges, which undermine public trust. Unannounced inspections exposed systemic malpractice, with patients being forced to pay out of pocket for services covered under the NHIS. Mr. Frimpong described the trend as a cancer, threatening the scheme's survival. NHI's head of communications, Madam Faustina Derry, condemned the practice and stressed that members must not bear the cost of inefficiencies. The forum concluded with a call by Madam Florence Fiajo for unity and collective reform. She emphasized that co-payments under the NHIS are illegal and must be eradicated. The task force next phase will intensify accountability and protect the scheme's integrity nationwide.
To our final story, the NHI Ahafu region and Regional Health Directorate have held a joint stakeholders forum in Goso to address illegal health charges. The forum focused on practical solutions to strengthen patients' protection and ensure scheme sustainability.
The engagement brought together health providers, NHIS officials, and community leaders to identify sustainable approaches to ending co-payments. Ghana Health Service Regional Director, Dr. Akosua Owusu Sapon, stressed the importance of collaboration, while NHI Regional Director, Mr. George Mauli, proposed deploying NHIS officers to health facilities for ongoing patient education. Mr. Mawuli also urged providers to renew their contracts on time and submit accurate claims to support accountability and financial planning. NHI Regional Operations Manager, Mr. Isaac Afari, explained how illegal charges distort reporting, weaken trust, and discourage healthcare access, especially for vulnerable populations. Participants raised concerns around tariff adequacy, delays in claims processing, and facility viability. They were assured that corrective measures are being taken to address all challenges raised.
See me rough off. I don't understand. I hope you've been taking your medication. I do better. Hey, foul. And I say, be pedroni boarding.
Hello, ma.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith in you. Listen, let me tell you, there's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the power of you, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
This brings us to the end of this week's episode of NHIS in a Week. For more stories, log on to our website on www.nhis.gov.gh and do visit our social media platforms displayed on the screen. My name is Bridget. Thank you for watching.